If the local economy has a bright spot, it's in healthcare, and there's more help for people who look to that field for jobs and new skills. One reason is the Longwood Community Skills Center announced yesterday. The center is a partnership that includes the city, medical institutions, and community nonprofits. Another reason is the new money for a healthcare training institute operated by Jewish Vocational Services with support from the city, the state, and foundations. And to tell us more is our guest from JVS, the president and CEO, Jerry Rubin. Thank you very much for being with us, Jerry.
It's a pleasure.
First of all, talk about this field. Why is it so bright compared to all the other fields in the economy?
Well, I think first of all, healthcare is probably one of the largest, if not the largest industry in Massachusetts and certainly in Boston. It's really, in many ways, it's an export economy. People are coming here for healthcare. There's research dollars going in. We have the biggest concentration. I think the Longwood Medical Area is probably the largest concentration of healthcare in any city in the country. So it's a very vibrant industry, and also the population's getting older. People need healthcare. In some ways, it's a bit of a counter-cyclical industry.
Now, people think usually about doctors and nurses, and we know, at least within some of those groups, that there are some shortages and a need for new people, but
yes,
there are many other types of jobs you're talking about.
In Boston, there are tens of thousands of people employed in healthcare, and it runs the gamut from the research side, which we're a leading city in terms of healthcare and biomedical research, all the way to those in allied health who are doing technical work, respiratory therapists and all of the technicians, and then up to nursing assistants, and then nurses, and then of course physicians.
One of the other things that seems to be an interesting part of these programs is that instead of giving somebody a job and they stick pretty much at the same level indefinitely, we're talking about people who could move up to another level.
Absolutely. The Healthcare Training Institute was built on the premise that people can get into healthcare jobs and then move up a career ladder. In fact, there are probably stronger career ladders in healthcare than in almost any industry. You can start in a nursing assistant's position, gain entrance into allied health positions or nursing positions, and there's many, many opportunities.
So how does this work? Because I can imagine the training as you go farther along gets expensive, at least ordinarily it would get expensive.
It does. We have tended to focus on those positions, particularly in allied health and in nursing assistance positions, where people can get either certificates or two-year degrees at the community college. We partner with several community colleges, Bunker Hill Community College, Mass Bay Community College, far more affordable than private institutions of higher education. And it also gives people an opportunity to learn while they're going to work. I mean, that's the wonderful thing about the Training Institute. We have the training space right there in Longwood Medical. People are done with their shift or before shift. They can come, they can go to classes, and they can gain the skills they need to go to college.
By the way, how affordable would this be compared with just a normal student going into a community college? Would there be some other kinds of financial help for students?
Well, for students that are working with us in the college preparatory classes, there's no cost at all. It actually is free to those students. So unlike going into a remedial education program in college, where you're going to be using up your tuition assistance or your federal financial aid, these classes are at no cost. They're shared both by the grant and by the employers. It's a real tremendous benefit to the employees.
And this preparation could be for some basic but still very important skills, maybe language? Or
yes, in fact, we start in Level 1 English for speakers of other language, because we're working with there's enormous numbers of non-native English speakers in the healthcare industry, and language is a big barrier, because if people may have academic skills, they may have the desire, but if they don't have the language skills, very tough to move into college. So we start right at the very basic level of English. We help people move up and move up in their career.
And by the way, you mentioned these jobs are not just in actual healthcare provider settings, but also in research. Now, when people hear research, we're thinking of people with postgraduate degrees, but,
yes,
but I guess there is a whole range of people that are involved in research.
Oh, absolutely. I mean, lab technicians, there's Harvard Medical School, which is obviously a big institution in the Longwood Medical Area, is an enormous employer, and all kinds of positions there that don't require a PhD. So it's a very vibrant part of the industry.
Now, the other program that's going on, this is the new program that we just heard about the money coming through for yesterday. This also involves working with the community-based organizations, mainly around Mission Hill.
Right.
How does that work?
Well, about 5 years ago, a number of community organizations in the Mission Hill area, I think, really pushed both the employers and the city to carve out space for that would be accessible for young people as well as adults to be able to have access to training. And through a really quite remarkable development agreement, Mayor Menino and the City of Boston structured an arrangement with the developer of this beautiful research building to carve out space, a classroom space, office space that's available specifically for neighborhood residents and employees who are working in the area. And that space is available at no cost.
By the way, is this a space that's going to be used by quite an age range, not just adults already working, but maybe high school students?
It is, yes. There are several community organizations in Mission Hill that are working specifically with high school students, doing introduction to the world of work. It's a perfect place to do it because they're right in the middle of one of the most vibrant healthcare centers in the country. We
should mention that Jewish Vocational Services has been around for a number of years. You have a number of different programs, and maybe we can mention some of the others that people might be interested in, especially if they're looking for that new job or that better job.
Right, of course. So yes, we've been around for 70 years. We got started at the end of the Depression, and we've been through lots of economic ups and downs helping people get into the job market. We do run a one-stop career center, which is at 29 Winter Street, and those job search services are available to anyone at no cost. We do one-on-one job coaching and career coaching, and then we also do training in other industries besides healthcare, in the hospitality industry, in the retail industry. And it's important to remember that even though it's a tough job market, there still are jobs out there.
And we should mention you also have a website with a lot more information?
We do. JVS-Boston.org.
All right. Thank you very much for being with us from JVS-Boston. Jerry Rubin. Up ahead, Vida Hispana with Margaret Troncoso after this message.
Did you know that annual HIV rates are increasing among Asians and Pacific Islanders in the U.S. faster than any other group? Join me in breaking the circle of silence and shame that exists in our community. We must show compassion for those who are already living with HIV and AIDS. Join me and show that you